Welcome to Obtaining Consent, a step-by-step guide. A storybook walk through trust, clear communication, and the importance of getting the paperwork right. Let's begin with Section 1, Mr. Wilson and the PANTHER study.
Good morning, Mr. Wilson. I'm Rachel, one of the research nurses here. How are you doing today?
I'm doing okay, thanks.
Glad to hear it. I wanted to talk to you about a study we're running. Is that okay?
Sure. What's it about?
It's called the PANTHER study. We're trying to find better treatments for ARDS, the breathing condition you're in hospital for.
Rachel gives Mr. Wilson a patient information sheet, which contains detailed information about the study.
There's no rush. Read it in your own time. There's also a video about the study you can watch by scanning the QR code. I'll come back later, and if you have questions, I'll be here.
Because informed consent starts not with a pen, but with space to think. Let's turn to the next section, the consent conversation.
Had a chance to read through the sheet?
Yes, I think I've got the gist.
Great. Just to recap, the study's testing medicines to treat ARDS, which makes it hard to breathe. Some people get standard care, others get extra treatment chosen at random.
So it's random, not up to you.
That's right. The computer assigns it to keep it fair. Most of the medicines have been used before, but we'll monitor you closely for side effects. You might benefit, or you might not, but your participation helps others in the future. If you agree, we'll collect some samples. Nose swab, blood, a bit of lung fluid, and check on how you're doing over time. Also, just to let you know, your data will be stored securely at Imperial University. If you'd like more information about this, I can provide a leaflet or show you where to find it online.
Yes, I'd like a copy, please.
We may also call you at 3 and 6 months to see how you're doing. And of course, taking part is entirely voluntary. You can change your mind at any time. Do you have any questions?
No, it all sounds clear.
And once signed, always check every field is completed and countersigned by someone on the delegation log. And remember, if it's not written down, it didn't happen. Add the participant ID, countersign the form, and scan or file it securely. 1 copy to the patient, 1 for medical records, 1 for the EISF. Always make sure you are using the correct version of the form. Sometimes, patients can't sign, but still understand. That's where a witness comes in. The witness must not be part of the research team. Their signature confirms the patient was informed and had their questions answered. When there's a language barrier, use the translated PIS alongside a hospital translation service or impartial staff who speak the patient's language. No matter the case, always document the consent discussion in the medical notes. If the patient lacks capacity, a family member or friend can act as a personal legal representative. Give them the study information. If they agree, use the correct legal representative form and document everything. If they can't come in person, discuss by phone, but only with an independent witness present. If no family or friend is available, a doctor or senior nurse not part of the study team can give consent as a legal representative. Their name must not be on the delegation log. Handwriting must be legible to ensure the pro-LR can be identified. If no per-LR or pro-LR are available within 2 hours, deferred consent is available and the patient can be randomized to the study. Written consent should be obtained from the per-LR or pro-LR as soon as possible. If the patient later regains capacity, they must be re-consented, in person, or if discharged, over the phone with a witness present, or via email using e-consent. The consent form may also be posted. It's very important to make the patient aware of the study, so try and obtain this in person. Informed consent is a process, not a moment. We follow up, we explain again, and we document carefully in the medical records. Give time, explain clearly, allow for questions, complete forms, store them properly, and always write it down. For full guidance, visit the PANTHER study site or speak to your R&D team.